Hello everyone, welcome back to another session in dentistry and more. So we're continuing our sessions in hand instruments. So today's session is about hand instrument techniques, basically the grasp and the rest. So the grasp includes modified pen grasp, inverted pen grasp, palm and thumb grasp, modified palm and thumb grasp. It's a commonly asked question. So modified pen grasp, as you see here, it permits the greatest delicacy of touch, similar to holding a pen, and we use pad of thumb, index and middle finger contact the instrument, while tip of the ring finger or little finger is placed on the nearby tooth of the same arch as rest. It is not identical, it may change from person to person. So palm of the hand facing away from operator, whereas inverted pen grasp, where the hand rotated so that the palm faces more towards the operator, and used mostly for tooth preparation utilizing lingual approach on anterior teeth. So this is inverted pen grasp. Whereas a palm and thumb grasp, where the handle placed in the palm of the hand and grasped by all the fingers while the thumb is free. And when thumb is free of the instrument and the rest provided by the tip of the thumb on the nearby tooth of the same arch or on a firm, stable structure. And we have modified palm and thumb grasp. It is used when it's feasible to rest the thumb on the tooth being prepared or the adjacent tooth. It is used universally and mainly on maxillary arch and best adopted when dentist is operating from rear chair positions. Now the rest in modified pen grasp and inverted pen grasp, rests are established by placing the ring and little finger on the tooth of the same arch. Okay, you can see here ring finger or little finger placed on the same arch as close to operating site as possible. So closer the rest, more reliable it would be. So you can make out the difference. There is no rest here, just one finger rest and two finger rest. So the hard tissue rest afford more control and they reduce the force or power that can be used safely. So when it is impossible to establish normal finger rests with the hand holding the instrument control may be gained using forefinger of the opposite hand on the shank of the instrument. And there is indirect rest, that is operating hand rests on the opposite hand which rests on the stable oral structure. So we keep our operating hand on the opposite hand which resting on the oral structures. Whereas a finger rest can be classified as conventional, cross arch, opposite arch and finger on finger. Conventional is nothing but the finger rest is established on the tooth surface which is adjacent to the working area. Whereas a cross arch, it is on the same arch. Sometimes it will be on mandible, sometimes on the maxilla, but on the opposite side. If you're working on the right maxilla, the finger rest will be on the left maxilla. And if we are working on the left mandible, the finger rest will be on the right mandible. Okay, that is cross arch. Whereas opposite arch, the finger rest will be on the opposite arch. If you're working on maxilla, the rest will be on mandible. And if you're working on mandible, the finger rest will be on maxilla. And the last one is finger on finger, which is established on the index finger or thumb of the non-operating hand. Okay, so we're using the index finger or thumb of the non-operating hand. And the next one is a fulcrum, oral fulcrum. We have two fulcrums. One is palm up and palm down. So it is established by resting the back of the middle and index finger on the skin Skin overlying the lateral aspect of the mandible on the right side of the face. Okay, that is palm up. The middle finger and a ring finger, the back of these two fingers will be on the right side of the face. Whereas the palm down, which is basically on by the middle and ring back surface, I mean the front surface, will be resting on the lateral aspect of left side of the face. That is palm down. Palm up is on the right side of the face, palm down is on the left side of the face. So that was all about rest and various thumb or pen grasp, that is the instrument grasp. So this was asked as a short note in the university paper. So next we have the four-handed dentistry, and after that infection control and the sharpening of instrument. So I'll come up with those topics. Thank you.